Hi, my name is Kennedie Kurtz, and this is my submission for the Nursing 4500 Unit C, Leading and Understanding a Video Reflection on Needs and Emotions. So getting started on my understanding myself as a leader, the two quizzes that I took were the Truity EQ test and then the Myers-Briggs type indicator. So my results for the Myers-Briggs test were INFP. So I have a slight preference for introversion, a slight preference for intuition. I have a distinct preference for feeling, overthinking, and a slight preference for perceiving over judging. And then for the Truity EQ test, my emotional intelligence type is the empath. So my strengths here are noticing when help is needed, showing care and sensitivity, and feeling fulfillment through service. So I think taking these quizzes kind of reinforced that I do heavily lean into understanding how my rest of the team is doing and how the rest of the team is feeling with the workload that we're having. As a leader, I think that these traits can help me as I am able to connect with the rest of the team and identify what needs are not being met and what we can do to meet those needs. And then I think this can challenge me as a leader in the sense that maybe I could be blinded by worrying about how the staff is feeling instead of making sure that we're actually getting certain tasks completed. And then I think an example of how this can affect team dynamics is I work in a pediatric behavioral health unit, and so we have lots of emotionally taxing patients with either difficult behaviors or just really difficult situations, and trying to navigate those. We have lots of problems with abuse and custody, and so I think that can weigh quite heavy on the staff. And so I think being able to do proper debriefings with them and connect with them on how they're feeling emotionally can maybe help the rest of the staff realize that there is someone in their corner and there is someone that's listening to them. So how this relates to leadership style, I've been researching this throughout the length of the course, through the different assignments, and I think that I most closely relate to servant leadership. I feel like thinking about my own leadership style and the quizzes that I've taken, servant leadership most closely aligns to like my values and what I would also want in a leader. So leaning into how my personality or emotional awareness can help or challenge me when leading a team. As said previously, I think that this can help me in a sense of making the staff feel like they're cared for. So they would be more likely to open up about different concerns that they're having, and so that we can make positive change in the unit. And then as a challenge, I think maybe staff could perceive me as like unserious or something like that. And then one way that I would use my leadership style to support a colleague or help them grow, I've recently been able to charge on our unit, which is kind of unique since I still am considered a new graduate. And so I've really been able to like lean into that role and lean into trying to lead my team through certain difficult situations like escalations. During these escalations, our patients can sometimes be physically aggressive towards staff and trying to hurt them. They also will attempt to hurt themselves. And so this can be really emotionally taxing as we're putting kids in restraints. We're giving kids IM injections. Um, and so being able to gather the team together after situations like that and being able to have a proper debrief and pulling from the different perspectives of everyone on the team, from our techs to our physicians to the nurses, and being able to kind of brainstorm what can we do differently to prevent that from happening again, I think is important, as well as talking to the staff and making sure that they feel safe, and then later debriefing with the patient and talking about what we can do to prevent that situation from happening again, as well as making sure that they feel safe because they are kids, and being in a restraint bed or being in seclusion or forced to take an IM injection is really traumatic for them. And so I think kind of tuning into how they're feeling is a strength for me. So in my own words, the Maslow's hierarchy of needs, this is a theory based off of like a pyramid. And on the bottom of this pyramid is the physiological needs. So this is leaning into the basic things like food and water, moving up into safety. Um, so moving from bottom to top. Above that is belonging and love, self-esteem, and then self-actualization. This pyramid is important because without fulfilling the needs at the bottom of the pyramid, we can't reach our highest potential at the top of the pyramid with the self-actualization. So what does emotional competence mean to me? Emotional competence is, I think, being aware of your surroundings and being aware of how your behaviors affect other people. An example of how I have understood someone's needs or emotions, once again, is kind of that same thing with the escalations, just leaning into what the patient needs and what the rest of the team needs in those difficult spots. Um, and then for the research article that I found, this article is Nursing in Maslow's Hierarchy, a Healthcare Pyramid Approach to Safety and Security During a Global Pandemic. This came out in 2021. This article is all about um, how the Maslow's hierarchy relates to the nursing staff of the global pandemic and how they were able to compensate and fill those physiological needs to assist nurses into getting up into the self-actualization level despite having a super stressful workload and a stressful situation. So one of my takeaways from this is how important it is to make sure that staff is having a healthy work-life balance, um, proper PPE to fill that physiological need, and then moving up even into the self-esteem, making sure that we're giving external recognition and encouraging them to have internal recognition so that they can work their way up so that they can reach the self-actualization and reach their highest potential in the position that they have now. Okay. Thanks for watching.